Living with lymphedema requires a focus on preventing infection, maintaining good skin care, and managing swelling. My next guest is going to share what we need to know about managing the impact that lymphedema can have on daily life and physiological well-being. Audrey Wall, welcome back to The Source. So wait, I have to take this off, is that right?
Yeah, that'd be a good idea.
Okay, I'm going to take this off and follow me for a minute. I'm going to completely take this off.
Oh, I see it over the head,
like
sort
that,
of
eh?
hockey
Just get her
move.
off.
Yeah, okay.
Now, you have these blue things here.
Yes.
What are these things? And you can start the process.
Well, I will tell you about this. So what I brought today, because I really want to get the word out that these things exist. This is called a sequential pneumatic compression pump. All right. Basically, it's a really cool way of getting gentle arm or leg or body part therapy to help with the swelling in a body part at home and easily. So you don't have to go out to a clinic. You don't have to call somebody in to do it for you.
So let's get this on. And
Right.
How would you? Okay, I need this device. Let's talk about how it is.
So first of all, we would measure you because this system is very, very, very individually adaptable, right? So this sleeve is a large sleeve, and what we would do is if let's say you needed help with your arm, we would measure you for an arm sleeve. Now, it's important that your fingers are inside. Can you feel your fingers?
Are there. Do you feel them?
Because what we want to have is we want to have gentle compression right from your fingertips all the way up to your armpit. All right. Now this is for demonstration purposes so that if you were dealing with lymphedema, we would set up a customized system that would work exactly for you. I'm going to turn this on and you're going to feel a little bit of this poofing up like so. Can you see it?
Yeah, and I can feel it too.
Right. It's very quiet. But what it does, because it's sequential, it goes from baffle to baffle to baffle and it fills up. And what it's doing is gently moving lymph in your arm.
So baffle is basically sections.
Yeah,
Okay.
yeah. Like you kind of see in a duvet quilt, you know, where they've got the down all in little sections. So you can feel it starting to move up just gently. Yeah.
Now it's at the bottom of my palm right now,
Right.
approximately. Now you told me earlier to not so much worry about how much pressure there's because you're going to measure for that. Is that right?
Yeah. So this isn't measured, this isn't PSI or anything like that. We measure in terms of millimeters of mercury, which is kind of the same as the blood pressure cuff thing that bubbles up and down. You can rest your arm down, Anthony. So if we were doing this for you in a therapeutic sense, we would create a program specifically for you. We would program the machine. You would be able to manage all of that at home. So you would say, well, you know what, right now it's too tight. Or you'd call us and you say, you know what, I think I could go a little tighter now. What do I do?
Now, what's this doing?
This is gently massaging the lymph in your body up into the main body part of you so that it can be excreted and that the limb, let's say you had a lymphedema issue, your limb could come down to a more manageable size.
Now, don't worry, I'm not going to take my pants off, but you have another.
Yes. Now these
And
look.
I'm sorry, I can't get my arm out of the way, just so
What?
you know.
No, you're fine. So what I really wanted to showcase was that, you know, let's say you have lymphedema in your leg. These are, again, customizable with zippers. We even have some sets that can go over both legs at a time. So you can sit on your sofa, you can put on your favorite TV show or your movie, and you can sit and you can get therapy right in your own home. That's the idea. Let's say a woman or somebody with breast cancer has had lymphedema also in their chest area where their breast used to be. There's vests that are made for this. It's all very, very customizable and specific for the issue.
And now this is connected to this machine. Now, before we get to what this machine does, you really want to push that the accessibility issue with this, right?
I really do. I want to give people hope that this therapy exists. It unfortunately is an expensive therapy. However, when you compare it to possibly having, oh, see, there it goes.
Yeah, it's deflating.
It's deflating, and that's the whole idea. Because this is set up on a 1-hour cycle, it's going to gently deflate, and then it's going to inflate again.
Let's turn this unit around for the camera, just so they can see what the front of it looks like. Okay,
maybe you can see it there. And then I think, is it loose enough for you to take your arm out yet?
Yes, I can.
It is. There you go. So the idea, do you feel energized? Yeah. Well, this is really for a person with lymphedema. This is not something somebody without lymphedema is going to go buy, right? But right now I've just put the machine on hold. And what that does is, let's say you have to go to the washroom mid-treatment. You just pause it, you go take care of whatever business, you go get your cup of tea, whatever it is, you come back to your therapy.
These are very pricey, is that
They
right?
are pricey. So this unit this way costs about $5,000 with the arm and I'm giving $5,000 as the upper. Okay, there's more expensive machines with many more baffles or many more outlets depending on what you need, right?
So push your MPP, your MP's Minister of Health.
Talk to your people.
Yes.
Because if you're looking to, the closest assistive devices clinic for this device is at Toronto General Hospital. And I understand currently they're not taking new referrals, so that doesn't help anybody. So the idea is if you're dealing with lymphedema, if you want something like this, talk to your MPP, talk to your MP, call your doctor's office, start making some noise.
Now, maybe next segment we'll do the leg.
We'll get you all set up.
I
No
won't even put
worries.
my jacket on. I'll just say thank you very much,
Thanks,
Audrey. Always a
Anthony.
pleasure. And thanks for bringing in this cool equipment that helps people with lymphedema. Thanks very
Yeah.
much for your time.
Thanks, Anthony.